Assalamualaikum dear student. Today I am going to talk about the cataract. So the cataract is actually the formation of the cloud area within the lens of the eye which lead to decrease in vision. So this condition is called cataract. Here you can see in the picture when the cataract become more severe, then it can be seen clearly from the outside. So the symptoms include the faded color in which the person is unable to see the colors clearly. Here you can see in the picture the colors seem to have faded, blurry or double vision, and the seeing of halos around the light in which the person become unable to see the light clearly. In trouble with bright light, the person become intolerant to see in the bright light. Here you can see in the picture in trouble seeing at night, in which can lead to accident and falling, etc. So the risk factors for cataract include the diabetes mellitus, smoking, prolonged exposure to light, and alcohol. These are the risk factors for cataracts. The causes include the aging, trauma, radiation exposure, and following eye surgery. After eye surgery, cataract may develop, and the genetics which play a main role in developing of cataract. So the prevention by cataract is wearing the sunglasses, and proper dieting, and avoid smoking. These are the prevention for development of cataracts. Treatment: use of glasses in cataract surgery, in which the cloudy lens become removed from the eye, and the new lens, artificial lens, is inserted into the eye, which can correct the cataract. It can correct the vision problem. So this was all about the cataract. For more videos, subscribe, like and share with your friends, and thanks for watching the video.